Well, breast cancer is the second leading cause of cancer death among women in Texas. October is Breast Cancer Awareness Month, and our Melissa Wilson checked in with a surgeon from Memorial Herman Southwest to talk about prevention.
As far as prevention is concerned, we know that early detection is the key here to saving lives so that we lower those stats. But let's talk about before even that mammogram, lifestyle. What lifestyle changes can women make to do their best to prevent it? We know some is genetic and you can't,
right? But
what are some things we can do to live better?
You know, probably one of the most important things that we have to do is just live a good, healthy lifestyle. Heart-healthy diet, eating healthy foods. If your heart is strong, then anything that happens, you should be able to recover from that. Limiting alcohol use is one thing, and smoking for sure. Smoking is probably the worst thing that people can do.
And then keeping an eye on what's going on inside your body. The rules change, the ideas change from year to year of when you should get that mammogram. Let's talk about right now. What's the best suggestion?
The current recommendation is to get a baseline mammogram between the ages of 35 and 40, and then annual at 40. Those recommendations might change if you have a family history of a parent, a mother who had breast cancer at a younger age. Then we might want to start screening you earlier.
A lot of women that I ended up interviewing found a breast lump on their own. Maybe they were in the shower. Maybe they were doing a self-breast exam. And sometimes that is in between mammograms. How important are self-breast exams, and at what age do you suggest that?
Well, all women at any age should be aware of their bodies. Even from their teenage years, they should be taught to be aware of their bodies and just to report any changes. But we do recommend probably, once a month, but a lot of women don't realize that they're actually doing 2 breast exams every day. One is when they are in the shower, we're bathing, we're touching our bodies, we're toweling dry. And the other is when we're putting on our bras. When you put on your bra, a lot of times you have to adjust your breast into your bra, and just by touching your body, if there really is a change, you will notice it.
That is so important to know. And then don't be scared if you find that. I think I've even talked to people who say, I didn't want to find out what it was, so I just ignored it. You got to get in early, right? Don't be scared. There's professionals, and Houston's one of the best places to get treated.
Yes, absolutely. Not everything that women feel is cancer, and so you shouldn't be afraid of that. What really women should be afraid of is what they don't know, and not having that information and not knowing what's happening is what's really detrimental.
What are other signs and symptoms to be alarmed about besides a breast lump?
Well, first let me tell you that the most common way to diagnose cancer in today's world is with a routine screening mammogram. Okay. Usually the other findings that we see on the breast, a thickening of the breast and a pulling in of the nipple, a bloody discharge, those are rather rare forms of identifying breast cancer, and usually might indicate something that's even a little bit more advanced.
Something that is much less talked about is inflammatory breast cancer, and that can even look like a bug bite. It can be red, inflamed, the skin looks like an orange peel. So you just need to look for any type of change, right?
Inflammatory breast cancer is actually not as common as people think, but it's really very striking. It's not just a little bug bite, a little round spot on your breast. It's really involving the whole breast, and the whole entire breast is changed.